Hello everybody, my name is Seth Kruger. I'm a current second year podiatric medicine student here at DMU. I'm the current president of ACPM, which stands for American College of Podiatric Medicine. And today, I have the luxury of speaking to you guys about diabetic neuropathy and general foot and ankle wellness. Let's get started. So a key stat that I found is diabetes affects over 100 individuals over the age of 50, which I just found mind-blowing. That's a lot of people, and I can't even conceptualize how much 100 million even is. So I want to start off too with some background, and I do realize that some of this maybe sounds scientific, but my job here is to kind of bring it down a little bit and make it so you understand what I'm trying to say. So diabetes is one of the most common chronic diseases known to date, and almost 1/3 of these patients have been diagnosed with diabetic neuropathy. So diabetic neuropathy is kind of a vague term, which can be broken down into 4 major categories. So local, diffuse, somatic, visceral, or mixed. I'm not going to get too into specifics about all of these, but just know that these can be broken down even more into what type of pain you can be categorized as. So some of these pain can include nociceptive pain, inflammatory pain, or pathological pain. Basically saying that you may have something wrong with your nerves. Maybe you see some swelling and edema in your lower extremities, such as your foot. So it could be kind of puffy, red, warm to touch, or pathological. So maybe you have an infection there that's kind of stimulating something that maybe causing something to hurt when you walk on it, or even when you're laying in bed or sitting in a chair. So in diabetic neuropathy specifically, pain has been described as sharp, stabbing, burning, or pins and needles, amongst others. So pain in diabetic neuropathy is one of the biggest things. So over 40% of primary care visits to podiatrists alone are patients complaining that their foot hurts or there's pain associated with their diabetes. So pain is one of the first physical manifestations of the disease as well, and it's usually an indication that something's going wrong, or I need to see a doctor, something's going on inside of me that, I don't know. And that can be described as a nociceptive pain, inflammatory pain, or pathological, which, just to repeat, is maybe a problem with your nerves, a decreased maybe stimulus going to your brain from your lower extremities as the foot. Maybe there's some inflammation, or maybe there's an infection or something pathological going on inside. So next, I just want to talk about some pain management in diabetic neuropathy. So the treatment goals in diabetic neuropathy include pain modulation, enhanced glucose control, restoration of function, and then patient education. So with common methods of treating diabetic neuropathy, you kind of tackle the pain modulation, restoring of function, and education if you can follow the guidelines of when to take drugs and how to do it properly and safely. So one of the first lines is NSAIDs, so non-steroidal anti-inflammatory drugs. These are things such as ibuprofen or naproxen, things that most of us are pretty familiar with, and they don't require a prescription. So you can get these over the counter at your local drugstore, such as Walgreens or even CVS. However, I want to talk about 3 main FDA-approved drugs that will require a prescription from your local physician. And I'm going to start with pregabalin, otherwise known as Lyrica. So, as I said, you do need a prescription for this, but it is one of the main methods of handling long-term pain. This was the second approved drug for diabetic neuropathy because very effective in reducing chronic pain and pain related to sleep interference. So in diabetic neuropathy, a lot of patients say I can't sleep at night. My foot hurts too bad. I'm getting this sharp, tingly feeling. It's burning. I can't fall asleep. So pregabalin is one of the main drugs that podiatrists specifically prescribe just for that. Next, we have duloxetine, which is known as Cymbalta. So this is chronic pain, and it works as an antidepressant. This is actually the first drug to be approved by the FDA for neuropathic pain with patients experiencing diabetic neuropathy. And it's also one of the most commonly ones that are still prescribed today. So if you need around-the-clock pain, or you just can't do really anything, your daily tasks, without severe pain, then maybe a physician might prescribe an opioid. One of the most common opioids prescribed is tapentadol, known as Nucyntin, and that's the most common, but it is noteworthy of opioids that they do have a high risk of addiction, and they do have long-term side effects. So if it's not too severe, or maybe you didn't have a recent surgery, you probably don't want to be taking these every day. However, they still are prescribed, and some people still take them every single day. So you may be thinking, what if I don't want to take drugs every day? As you know, pharmacological drugs do have a lot of side effects, and as you get older, you can have way more adverse effects. So these things, if you don't want to take drugs, and you still have, type 1 or even type 2 diabetes, maybe you're a little overweight or your BMI is a little high, most doctors will recommend lifestyle modifications. So this will include increasing your daily exercise. So obviously, most people aren't going to be lifting the heaviest weights in the gym or going for 10-mile runs every day above 50, but going for a walk, doing water aerobics, and eating a healthier diet. So having more protein and carbs and healthy fats and kind of staying away from the junk food can go a long ways. This can help control your HbA1c level, which is just known as your glucose, which most diabetics should be taking. Actually, all of them should be following and controlling their HbA1c, levels. So other things you can do is physical therapy, and this can focus on balance. If you have balance, you can improve your risk for ulcers. Ulcers are a big thing with diabetic neuropathy. So if you have pain in your foot and you have an ulcer forming, you probably won't notice because it hurts and you're probably not walking on your feet. And going to physical therapy and focusing on your balance can also lead to a decreased risk of a hip fracture, which could lead to more adverse effects and things down the road, such as osteoporosis. So maybe you don't have diabetes, type 1 or type 2. There's still some general foot and ankle wellness things you can be doing. Go see a podiatrist. Get your toenails trimmed there. This can prevent infections. Maybe you have an infection that you think may look normal, that they can find something. Moisturize your feet. Use aloe vera or cocoa butter. Those have been the two that have found the best results for maintaining moisture in the feet. Look at your feet. Don't ignore pain. Pain is an indication that something is going wrong. So some things you may notice are bumps, sores, decolorizations, or just other abnormalities. And when it comes to footwear, wear adequate footwear. Make sure they fit the proper way. You have good support when you're walking. Go see your podiatrist regularly. We're not scary people. I'm not a podiatrist yet, but all the ones I've met are very nice people, and they want to help. A lot of them get into this field to help with conditions like diabetic neuropathy. And stay active. Staying active is one of the best things you can do. So in conclusion, diabetes is a rapidly growing disease that needs to be properly treated to promote adequate quality of life. You do have pharmacological options that you can take pills, things as pregabalin, duloxetine, and tapentadol, amongst others. There are non-pharmacological treatments such as lifestyle modifications such as exercise, diet, and physical therapy. And general foot and ankle wellness includes trimming toenails, moisturizing the feet, seeing a podiatrist, wearing adequate footwear, and staying active. So that brings the end of my presentation. These are my references. I hope you guys enjoyed. Thank you.
At Des Moines University's Family Medicine Clinic, our goal is to provide you with compassionate care that is comprehensive. From caring for children to the elderly, our medical team provides holistic preventative guidance on how you and your family can maintain a healthy lifestyle and manage any symptoms that may arise so that you can be at your best. During the current COVID-19 pandemic, maintaining your health as well as a safe lifestyle has never been more important. Our providers are here to help when acute conditions affect you or your family. We treat musculoskeletal injuries, infections, illnesses, and many other medical conditions. As an academic medical center, DMU is training tomorrow's healthcare providers on how to provide expert care to people from all backgrounds. We invite you to visit the Family Medicine Clinic at Des Moines University. We offer the care and attention you deserve.